Hey teams, Lauren and Rebecca here with Bizrok. In this week's video, I'm so excited because it's a continuation of a clinical training conversation that we've had before. You do a lot of clinical team training and focused on both bringing the front and the back together. And I know we've done previous videos on the front office value to the patient, but today I want to talk to you about bringing clinical team members, having them bring value to the patient. So what does that mean to you?
It all starts, guys, in morning huddle. I know you have already watched the videos that are out there about the morning huddle that Lauren has given to all the offices. I would suggest rewatching those videos. It's where it all begins, making sure your morning huddle is done, which actually starts with your chart review.
Yes.
So that's where it all begins. When you are seating your patient, please reconfirm their treatment. Again, morning huddle, guys, you've already talked about it. You already know as a team what treatment is going to be done that day. To reconfirm it with the patient, they may have questions. I always suggest when you're bibbing your patient, as you're putting that bib on, go ahead and ask them if they have any questions and reconfirm the treatment with them.
I love that you're bringing this up because, we sometimes joke about the walk of amnesia. So when the patient's in our chair and we're presenting treatment, for them to come back and see us, and usually by the time they're moved to the front office for checkout to go over the financial side, they've already forgotten what the treatment plan is.
Completely.
So when they're coming back weeks, sometimes months after that treatment plan was presented, gosh, the amnesia sets in even more.
It does.
So it is, I think that's so important that you bring that up because we can't just assume that the patient's like, oh yeah, I know why I'm here for today. Like we have to re-educate them and ask them questions they probably have forgotten.
Well, and it's funny because you know that your reception area, they've been sitting there, and I feel like the nerves build as they sit there and wait on their name to call, and then when they come back, all of a sudden they just forget.
Yes.
Everything. So that's why I like to reconfirm and ask them before you reconfirm, do they have any questions? And then tell them what treatment they're going to have done that day. That way, that kind of opens the door for anything else to be asked as well.
Very good. So it starts with the morning huddle, and then once they're in your chair, the most important thing is reconfirming treatment. I know you also have some other, you must always do this, no matter if you saw the patient yesterday or this morning and it's an afternoon appointment. What is that rule?
So it even comes into if you saw them that morning. So if the patient's been in the office, just for an example, they had hygiene done that morning. When they leave, we do not know where they're going. Please reconfirm medical history.
Thank you.
What if they left the hygiene operatory and then they went out into the world and they had to see their PA for something and something medically changed? You have to ask your patients every time they sit in your chair what their medical history is. If there's any changes at all, any changes to medication, please ask. Always, always, always ask that. We do not know. And I always feel like we get a little bit of pushback because they're like, well, they were just here. Why do we ask them again? We do not know what has happened, even if it's been 30 minutes. If they have left that office, please always reconfirm. So not only reconfirm the treatment, reconfirm their medical history. And guys, this is forgotten all the time. Please reconfirm when last time they ate and drank anything. Even if they are not supposed to be on nitrous oxide, we don't know what's going to happen in the middle of the appointment. Some people also get the palpitations from the epinephrine and it makes their stomach feel uneasy. We need to know if they just ate a huge lunch and then that happens, we can be prepared.
Yeah, I love that because it takes the liability off of us. Well, as long as we're documented, right?
Right.
I always say if it's not notated or documented, it didn't happen. Your notes are there to protect you guys. But I am so glad that you brought up, what did you eat and drink? Because sometimes that's probably the most forgotten about. But I know we have this conversation often. I'm always shocked at how many times we walk around an office and, we're listening, we're implementing from the day before's training, and we don't hear, are there any changes to your medical history? Guys, that's the most basic type of clinical training. That's 101. We've got to know, are there any changes? Are there any new medications? And just documenting it. Even if the patient did have changes and they forgot to tell you, that's on them as long as we ask and notate it.
Absolutely.
So I'm glad you brought that up.
The other thing we also have to ask about is the medication that they've actually taken.
Yes. Just
Just because it's on their medical history doesn't mean they actually took it that day. Or if they did take it, doesn't mean that the milligram has changed. And we do need to update that. So always review the medicines that are listed and all the medication that they have taken that day, and then reconfirm it verbally and then notate it. Because again, if it's not notated, It didn't happen. Notes are legal, guys. We've got to remember to make sure we always put everything that the patient is saying to us in our notes.
Very good. And these are just a few things on how to increase your value from a clinical standpoint as a clinical team member. I mean, it protects you, especially if you're a hygienist and you hold a license, if you're an EFTA, but it also protects your doctor, which ultimately makes you more valuable to the practice, right?
It does. You have to protect everybody. Guys, we're a team. We have to protect each other in the seat. Being when it comes to the patients walking in until the time that they actually leave the 2 front doors. Make sure you're protecting and notating it all. We need to protect everybody's license that's in the practice.
Love that. Awesome. Well, guys, as always, we are here to help and serve you. So if you need anything or if you have any additional questions about how can I increase my value or become more proactive taking care of and serving my patients, reach out to us, send us an email, info@bizrok.com. Otherwise, we can't wait to see you and serve you soon.